Evan's good to go. Testing 1, 2, 3. Declan, you good? I'm not sure about the tyres with this temperature, but here we are anyway. Morning all. On Friday, National Cabinet will meet, and we still haven't heard a peep from the Premier about 50-50 health funding. This was the signature reason the Premier gave us why Queenslanders should help change the federal government. We were told about a new era of cooperation, we were told an end of the squabbles, and we were told that 50-50 health funding would be delivered. Not only hasn't that occurred, we haven't even heard the Premier go to bat for it anymore. It's like it no longer matters. And in a moment, I'm going to ask Jared to reveal some pretty startling information that's come to him from a whistleblower in his capacity, not as Deputy Leader, but as the local MP here. And Brent's going to talk you through some of the figures. But make no mistake, health systems across this state are under immense pressure. There has been a decline in figures for nearly 8 years, and it's a result of poor planning, a resistance to share information, failure to put frontline staff back in charge, and Queenslanders are living it. And here on the sunny coast, there's been a massive spike in ambulance ramping, up to 44% in the last quarter. There's only one reason that occurs, and it's not because of the hardworking men and women behind us. It's because of a government that hasn't planned, hasn't listened, and hasn't allowed them to do their jobs properly. And we're going to continue to fight for them, because right now the last thing staff need, the last thing patients on the sunny coast need, are further cuts. And what Jared is about to reveal is, quite frankly, troubling for all of us. Over to you, mate.
Well, thank you, David, and good morning. Jared Blee, Deputy Leader of the Opposition, but today member for Kawana, and I'm very pleased to welcome David Crisafulli, Leader of the Opposition in Queensland, to the Sunshine Coast, together with my colleague on the Sunshine Coast, Brent Michaelberg, the member for Buderim. So, David, thank you for coming to the coast, and thank you for listening to the concerns of many of the hard-working nurse staff behind us here at Sunshine Coast University Hospital. So I want to make the comment first, and I want to thank all our frontline workers at SCU and all the other health facilities on the Sunshine Coast and our AMBOs. They do an incredible job. They do not have the support they need from the state government, though. So first off, a big shout out to all our frontline workers, particularly those that will be working over the upcoming Christmas holiday period while people are having some time with their families. We'll have many nurses, doctors, cleaners, everyone behind here at SCU working on those days, so thank you very much for all the efforts you do. I've been contacted by a whistleblower who works at Sunshine Coast University Hospital. This is very startling information. Only a few days ago I stood up in Brisbane with the Leader of the Opposition where we talked about government cuts to the PA hospital. Well, it appears these cuts are not only to the PA hospital in Brisbane, but they also are on the Sunshine Coast. I've been told that the Sunshine Coast University Hospital has had to cut by $20 million their budget. Now think of what that will impact on patients at the Sunshine Coast University Hospital. $20 million. When we talked about the PA hospital in Brisbane a few days ago, we spoke about a government cut of $9 million. We're talking about a $20 million cut. Now, how does that impact on patients? Well, I've also been told by this whistleblower from SCU that we have arrangements in place with the University of the Sunshine Coast for obviously our nursing and our graduate nurses. And when a nurse graduates, they obviously have to have some form of supervision. And that supervision is undertaken by clinical supervisors and facilitators. I'm advised they will be sacked. Now, this government says they support the front line. Well, if you've got the people who are making sure that the graduate nurses are completing their assessments and doing everything right, if you're getting rid of those people from the Sunshine Coast University Hospital out of that $20 million cut, then that is bad news for patients, that is bad news for our new nurse graduates. The other thing I've been told is from April next year, there will be administration staff at the Sunshine Coast University Hospital who will also lose their jobs. And finally, I'll end on this. In terms of nurse-patient ratio, this Labor government legislated nurse-patient ratio of 4 patients per 1 nurse. We have nurses at the Sunshine Coast University Hospital who have recently been asked to have a nurse-patient ratio of 6 patients per nurse. Now, they've refused. They are doing 5 though, which shows the nurses are stretched, the resources are stretched. So not only are our hard-working nurses battling through the FX and the COVID cases that are going through our hospital, but they've been asked to do more with less. They've been asked to work longer for less, and that is unacceptable. So I want to say thank you to the nurses. Thank you for bringing this to my attention. And the questions the government have got to answer today is this. Why are they cutting $20 million from the Sunshine Coast University Hospital? Why are they sacking administration staff and facilitating staff who are making sure graduate nurses are fulfilling their obligations under their graduate program? And why are nurses being asked to go above and beyond the legislated nurse-patient ratio that this government promised would not occur under their watch? So these are the big questions, and I want to thank the brave whistleblowers that are continually coming to the opposition now and exposing how bad it is in the Queensland health and Queensland health crisis today. Thanks, Dave. Thanks, Brent.
Thanks, Jared. Morning all. Brent Michaelberg, Shadow Minister for Open Data and Member for Buderim. Well, the health system here on the Sunshine Coast is broken. You've heard about the ramping results here on the Sunshine Coast at the University Hospital, 44% for the last quarter. But elective surgery here on the Sunshine Coast, here at the Sunshine Coast University Hospital, the performance is the worst in the state. Here at the Sunshine Coast University Hospital, 90% of Category 1 elective surgery patients wait for an average of 55 days. 55 days when they should have got surgery in 30 days. What that means is patients who have the need for a major limb amputation or advanced cancer patients are not getting the surgery they need in a clinically recommended time. And let's not forget that those patients need to wait on the wait list for the wait list just to get on the elective surgery wait list. So many of these patients are waiting an inordinately long period of time and their health is suffering as a consequence. The government have given up on trying to solve this problem. It's very clear from the Premier's silence that she's given up on patients on the Sunshine Coast. She's given up on the Category 1 patients who are waiting nearly twice the time that they should to get the surgery that they need and that they deserve. And the government have given up on being open and transparent. The government have previously published data monthly. Now they publish hospital data every 3 months, and much of that data is not published for 2 to 3 months after the end of the quarter. The most recent data we've got here for the Sunshine Coast University Hospital is from the end of September. That is simply not good enough. The government need to publish health data in real time, and the reason they need to publish that data in real time is so that the patients who are sitting on elective surgery wait lists, patients who are sitting in an ambulance on the ramp here at the Sunshine Coast University Hospital are able to have their voice heard. They're able to drive improvement in the system. We know that when we measure systems, they improve, and the government can implement measures to resolve some of the issues and some of the challenges that Jared's spoken about that are facing the Sunshine Coast University Hospital. So the government needs to be open with the people of the Sunshine Coast. They need to admit, firstly, that there's a problem here on the Sunshine Coast when it comes to the health system. They need to admit that 90% of Category 1 patients are waiting nearly twice the time frame that they should for the elective surgery they need. 50% of Category 2 patients, these are patients with serious conditions that should have been seen within 90 days, are waiting longer than clinically recommended. That is the worst in the state. And Sunshine Coast residents deserve better than what they're seeing from this current government. I'll hand over to David for questions.
Thank you, Brent.
Are you able to give any more info about this budget cut? Has it already started? When will it start? How long is this budget, or is it minimal?
I will ask Jared to go into a little more detail, but I'm going to make this point. When we stood up in Brisbane and spoke about the cut to the PA, we said that there would be more to come. And here it is, another brave whistleblower coming forward. Today, the Treasurer is going to stand up and crow about the rivers of gold that's flowing into the Treasury coffers. Taxes are up and services are down. Queenslanders are paying more and getting less. And that's a result of 8 years of very poor planning and very poor delivery. Do you want to talk a little more?
Well, thanks, David. My understanding is this $20 million cut, and I might reflect on the PA hospital where we spoke a few days ago about the $9 million cut. The Health Minister then got up that morning after it was reported in the media about the $9 million cut, and she never denied it. She actually attacked hospitals and hard-working hospital staff. This is the reality. Governments give the budgets. The governments are reliable. They have to be reliable for the resources for the hospital to run their services. So you know, if the government think that a $20 million cut to Sunshine Coast University Hospital will not have an impact, then I do not know what planet Yvette Darth is living on. We've also been told, with respect to these cuts, that the nurses are being asked to do additional duties because there's industrial relations action with the wardies on site at the moment where they're not doing certain activities, which the nurses are then required to do. So they're being asked to do more than the nurse-patient ratio that's legislated. They've been asked to do more tasks with the nurse graduates that they haven't been having to do in the past because people will be losing their jobs under these cuts. This is the reality. So we hear these facilitators they've already been advised that they're losing their jobs. The administration staff is from April next year. So when I got told by this whistleblower, it aligns with other stories we are hearing from other whistleblowers across the state and other hospitals. And we have to believe these people because they are to the extreme now where they're talking to the opposition because they want to expose these issues and they want to expose the lies of the Health Minister and the Premier. And my message to the Premier and the Health Minister is stop with the cuts to our health and hospital services. Stop with these cuts to the Sunshine Coast University Hospital and stop the cuts and the lies. They are lying to people when they're saying it is not happening. It is happening.
I'd like to just ask as well, another interest rate rise, that's bad news.
Deeply troubling, and there is no doubt that there's some hardship ahead, which is why the state government has to start respecting people's money. And when you hear of every major project that is being undertaken at the moment by the state blowing out, there's a cost there. And the cost is to the taxpayer. There's only so much money to go around. And when the government can't manage their money, they come after yours. And at the moment, Queenslanders are deeply concerned about what lies ahead. And we want to see the government treat their money with respect. We don't want to see new taxes dreamt up constantly. We don't want to see blowout in projects. We don't want to see cuts to services. We want to see a government that treats Queenslanders' money with the respect that it deserves, because they go to work, they work hard, they make sacrifices, they pay their taxes, and cost of living pressures is a real thing that's going to be facing everyday Queenslanders. Thank you, guys.
Everybody.
Cheers. Thanks very much.
Have a good day.
Thank you.